Okay, I'm gonna try to not mess this video up. I've tried it like 5 times, so I'm sick of it. Non-invasive blood pressure monitoring is what I want to talk about today. And so that is the blood pressure that we use in the ICU. It's the cuff, the automatic cuff. It's probably the single most important video that I could provide to you guys, I think, because it's so important that we make sure that we take accurate blood pressures, and then we also understand how the equipment works, and that we are capable of troubleshooting the non-invasive monitors so that we are not doing our patients harm. So there's been a couple patient scenarios that I'll kind of also talk through, things that I've been fooled by as well, and what we do in those circumstances to make sure that patients are taken care of. So first of all, just this is a general rule for pulse taking, and I've learned this like in the last year. I did not know this, and so I can learn things too. So if you're in a circumstance or a position where your systolic blood pressure reads 40 on the monitor and your patient looks like crap and you're worried about them and you're like, oh my gosh, what is my blood pressure actually? You can feel the patient's pulse, okay? And so different areas of the body have different measurements. So if you can feel a radial pulse, then your patient's blood pressure is at least 80 millimeters of mercury, okay? So start by trying to feel radial. If you can't, don't assume there's no pulse. Feel the femoral. If you can feel it, then your blood pressure is at least 70 millimeters of mercury. If you can't feel it there, but you can feel a carotid, then your blood pressure is at least 60 millimeters of mercury. So that can be extremely helpful. You're going to be able to feel a pulse here, move down to the fem, see if that patient's getting pulse, higher blood pressure by titrating your medications up a lot quicker than you're going to be able to get an accurate blood pressure on your non-invasive. So in oh shit circumstances, that's kind of a really helpful tool to use. So 80 for the radial, 70 for the femoral, and 60 for the carotid. So other really simple things with the non-invasive is it is important that you make sure the cuff size is appropriate for the patient, because cuff size can falsely elevate or give you an inaccurate lower blood pressure. Positioning of it is probably the biggest thing for me to talk about here. So not only positioning it, like how you position it on the arm, but also where you position it on the body and how that impacts and influences your blood pressure. So there is a symbol that has the arterial symbol on the cuff. And so making sure that you line that up with the artery. So the brachial artery, the radial artery, if you're doing it on the leg above the knee, the popliteal artery, and then if you're doing it on the ankle, it's the artery on the inside of the ankle. So, so lining it up with those areas so that the sensor can accurately be able to detect that measurement. The position of the body, so where it's at, in proportion to where the right atrium is, influences your blood pressure. So just like the transducer that we have on the A line, we always want to put it at the level of the right atrium. That's why I say your blood pressures on the upper arms are the most accurate. Anytime the blood pressure cuff is taken below the right atrium, you will have a falsely elevated, a falsely high blood pressure, okay? So if I have it on my wrist and it's down by my hip and I take a blood pressure, then my blood pressure is going to be falsely elevated. Most accurate way to measure that would be for them to put it over their chest and then to take it like that. And that, you don't have to do that every time, but just being conscious of that if we don't have any other opportunities to measure their blood pressure. If the blood pressure is on the ankle or the leg and you are setting the patient straight up, then it's going to be falsely elevated. So this actually happened where we were in rounds and a patient was setting up in the bed, and doctor kind of wanted to put Entresto on, which it does lower your blood pressure. And I walked in and said, the patient's blood pressure, we need to check it because it's 118 on the ankle and you don't have room to start your Entresto. So we checked the upper arm and it was like 92 systolic. So we could not start that medication. So it's important to know that. It's super, super important. If you're taking it on the leg or the ankle, ideally you should lay your patient flat and check the blood pressure, so to get the most accurate measurements. So this is important if you have somebody who's borderline, or if you have somebody who's slightly hypotensive, or somebody who's in shock, or somebody who's on pressors. Like, that's not somebody you want to be taking blood pressure on the ankle. Other limitations to the non-invasive blood pressure cuff, and this is where it's grossly inaccurate, and we've had 2 patient cases where this was patients actually were impacted by it. So patients who have Parkinson's disease and they're shaking, if they have fever and they're tremoring, or if you have patients who have irregular heartbeats, so someone who's comes in and has a heart rate of like 140s and AFib RVR, those things can impact your blood pressure to where the non-invasive is completely wrong. It can tell you the systolic blood pressure is 200 over 140, and in turn you can have a systolic of 50. I've seen it. So I want to go through a patient scenario that actually did happen and what we did. The other thing is, if the patient's frequently moving, then you can also have irregular or inaccurate blood pressures as well. So this patient, I'll tell you, came in severe septic shock, hit the ER door with a blood pressure of 60 systolic, was placed on Levophed, got IV fluid resuscitation, had fever of 103, heart rate was 140 to 170, was initially given IV fluid resuscitation, put on Levophed, heart rate was still super, super high. Doc put him on amiodarone. Blood pressure started reading about 200, and they titrated the Levophed off. I came in, rounded about 7:30 in the morning, looked at the blood pressure, looked at the patient. Patient was mottled from nipple down, and had lactic acidosis, profound hypotension, was obviously in shock. Saw the non-invasive, said that, and asked the nurse to do a manual blood pressure. Okay. I simply told her that is not an accurate blood pressure because I could clinically look at the patient and know just what was going on. Okay. So we checked blood pressure. We could not get a blood pressure, could not hear it. So we're looking at our patient here at this circumstance. The other thing is whenever you're doing your manual cuff pressures, making sure if somebody has a ginormous arm, making sure you can feel the actual brachial artery, find it with your fingers first, and then put your stethoscope over it, because sometimes if you don't have the stethoscope directly over it, you're not going to hear it. So that was something that I had to do. He had a systolic of 50. It was 50. So we put an A-line and put him on pressors. But I just think about this patient and his lactic acid following the Levophed not being on because the measurement was 200. His lactic acid went from 4 to 9. His kidney function did not get better. He made 0 urine. And subsequently, he ended up dying. So, just one of those circumstances. Other things that can impact your blood pressure is subclavian stenosis. So if you, anytime I have a blood pressure that I'm not okay with, if I get an opportunity during the day, sometimes checking blood pressure on both arms. If you have a significant difference in them, then you should choose the blood pressure that's higher. So hemodialysis patients, peripheral vascular disease, all of those things can impact your blood pressure. So looking at the patient is a big thing, because a lot of these people are just not great vascular patients. So I think that's really it. It's a really long video, but it's super important. If you guys have any questions, please put it in the comments, and I really appreciate you guys watching these.